Hey everybody, welcome back. I'm Levi from Amara Massage and Wellness, and today I want to show you another thing that's going to kind of help out with this upper body tightness that you might be experiencing. Any of you out there have ever had any discomfort or sensation of tightness or pain, between the shoulder blades? Yeah, I'm one of them. A lot of my clients come in saying, between my shoulder blades, it just gets really sore and it feels tight, and sometimes even underneath the shoulder blade, it feels kind of funky, right? So what I usually recommend for that, obviously, massage feels great on that, but then something a bit counterintuitive is not stretching that area anymore, but stretching the opposite side of the body, right? So think about, a lot of people who do, again, PC work or driving or basically anything that we, any job that requires us to work in front of us, which is almost everything, right? Not a whole lot of jobs where you have to do this, right? So this area in the back, it kind of gets left out a little bit, in this area, a bit overstimulated. In this area back, it gets overstretched, these muscles that connect from the shoulder blades, into the middle of the spine, they get kind of pulled across the rib cage in the back from being in these positions for long periods of time, right? So something I like to do is to get those scapula to move back, activate that area in between those scapula, those shoulder blades, right? And things to help kind of loosen up my chest and shoulders, right? So here's a little test for you to see if your mid-back area between those shoulder blades is awake and moving how it should be, right? So what we'll do is at home, maybe you can get a pencil or something like that. Today I'm going to use this band because I'm wearing a shirt, and this exercise is infinitely difficult wearing something that's kind of slippery like this, right? If you use your bare skin, it's going to work much better. But let's try it out anyway. I'm going to have my camera person hold this little tube here, and the test is she's going to put this in the middle of my back where my spine is, right between my shoulder blades. And what I have to do is I have to squeeze and hold. Right, so if you can do that, then it means that that area back there is working as it should. Those scapula can come back and squeeze together. If you're not able to hold an object like this or a pencil, a pen, something like that in between your shoulder blades like that, then maybe you can do some things to kind of wake that area up a little bit, and you might notice that it feels really good afterwards, right? So here's a first thing you can try. They're called shoulder dislocates. And no, you're not going to dislocate your shoulder. So I'm going to grab my trusty band because bands are probably the safest way to start doing this exercise, right? Because it has a little bit of give, and if I reach a point that feels a little dangerous for my shoulder, well, the band's gonna relax and let me get through that motion. Let me just show you what it basically looks like. I'm gonna grab the band, keep my arms straight, and I'm gonna reach behind me like this. Yeah, and then just come back forward again, right? Here's a little side angle for you. Right, that's called a shoulder dislocate. A lot of gymnasts use this kind of move to get those shoulders loosened up. Feels great, really. So yeah, just try that out. Remember, it shouldn't be painful. It should feel really good. It should feel like you're hitting some spots that you don't normally get to hit. Yeah, you're waking up the mid back area a little bit. You're squeezing your shoulders together in the back. You're opening the chest up, getting a nice stretch. Yeah, if it feels good and if it's a little easy for you, then you can you can choke up on the band here, right? And then you can do it again. Do a couple of these. You can do these throughout the day. Anytime you feel like you're a little tight, take a break from that computer, get up, and maybe do 10 of these. Should feel nice and easy. Should feel good. Take that breath. Yeah, wonderful, right? And then as you get better and better, you can move up further and further on the band until you do like some of these guys on YouTube. They can do it from here with their hands behind or by their side and go all the way back. I'm not quite there yet, but maybe one day. If this isn't challenging enough for you and you want to add a little more spice to it, you got to get something that's not flexible, like a stick or something. So I got my handy dandy stick here, and this one is not going to move and it's not going to flex, right? So I need to be a little bit more careful with this one. Grab it out on the edges, and then I'm just going to try it out. You'll notice on this one too, you get a really nice kind of a forearm twist because holding onto that bar doesn't allow my wrists to turn like it would with the band, right? So this one feels quite good, right? Here's a little back view for you. Notice how my shoulders are really squeezing together. I'm really letting that happen, right? I'm not collapsing forward and trying to do it like this. This is a cheat. This is no good, right? Nice and straight. Squeeze those shoulders in the back, right? Feels awesome. Oh. You can even do something kind of fun like this where the palms are facing out. Grab onto that guy, and then we do it this way too. Boy, check out that forearm stretch you get on this one. Great for massage therapists or anyone who's doing a lot of work, you know, PC work and stuff. Your forearms get tight, right? You're using them all day long. So this is called the shoulder dislocate, right? Great for the shoulders, great for that mid-back tension feeling, you know. I'll throw these guys in, you know, all throughout the day. Have some fun with that. Keep those shoulders healthy, yeah, flexible and strong, and have a great day. We'll see you guys next time.